Hey guys, what's up? Welcome back. So in this video we are going to discuss about the anatomy of the popliteal fossa in terms of its boundaries and contents. So when it comes to the popliteal fossa, this is a hollow shape on the back of the knee. It is situated on the back of the knee, as well as it also forms an important anatomical region because it provides passage for the main vessels and nerves that pass from the thigh to the leg. Okay, so now moving on to the boundaries of the popliteal fossa. So what do we have? We have a superior-medial boundary, a superior-lateral boundary, and then we have inferior-medial boundary as well as the inferior-lateral boundary. It just looks like a diamond shape, right? So it is also, you can also call it as a diamond-shaped hollow structure. So it is, we have a superior-medial boundary, superior-medial, then we have the superior-lateral boundary, and also we have inferior medial boundary as well as inferior lateral boundary. We have, these are the four different boundaries of the popliteal fossa. Okay, now what are made up of the what are the structures that make up these boundaries? On the superior medial boundary we have the two muscles known as the semitendinosus as well as semimembranosus. Semitendinosus as well as membranosus. So we have two muscles, we have this tendon of the semitendinosus as well as the semimembranosus. They make up the superior medial part of the popliteal fossa. So when it comes to the superior lateral part of the popliteal fossa, it is made up by the biceps femoris. It is made up by which muscle? By the biceps femoris. Now when it comes to the, this is about the superior lateral, right? So when it comes to the inferior medial part of the boundary of the popliteal fossa, inferior medial part is made up by the medial head of the gastrocnemius. Medial head of the gastrocnemius muscle. Gastrocnemius. Medial head of the gastrocnemius forms the inferior medial boundary of the popliteal fossa. And now moving on to the inferior lateral boundary of the popliteal fossa, it is made up by the lateral head of the gastrocnemius. Lateral head of the same gastrocnemius. So again, repeating it again, we have four boundaries of the popliteal fossa. We have superior medial boundary, superior lateral boundary, inferior medial boundary as well as the inferior lateral boundary. Superior medial boundary is formed by the two muscles, that is the semitendinosus as well as the semimembranosus. Superior lateral boundary is formed by the biceps femoris. Inferior medial boundary is formed by the medial head of the gastrocnemius, and inferior lateral boundary is formed by the lateral head of the gastrocnemius as well as the one more small muscle which is known as the plantaris. So plantaris also makes up the lateral inferior lateral boundary of the popliteal fossa. So this is about the boundaries of the popliteal fossa. Now when it comes to the roof and the floor, firstly we will discuss about the floor of the popliteal fossa. So the floor of the popliteal fossa is made up by the popliteal surface of the femur, as well as the capsule of the knee joint. Capsule of the knee joint. So we have capsule of the knee joint as well as the popliteal surface of the femur that make up the floor of the popliteal fossa. Okay, now moving on to the roof of the popliteal fossa. What do we have on the roof of the popliteal fossa? The roof is made up by the superficial fascia. Roof is made up by the superficial fascia which contains, it contains the short saphenous vein, as well as it also contains the sural communicating nerve, the posterior cutaneous nerve of the thigh as well as the medial cutaneous nerve of the thigh. We have the posterior as well as the medial cutaneous nerve of the thigh, as well as we also have sural communicating nerve. Sural communicating nerve. Sorry if it is not visible, it is known as the sural communicating nerve. So the roof is formed by the superficial fascia which contains the short saphenous vein, the posterior and as well as the medial cutaneous nerve of the thigh, the sural communicating nerve. So this is about the roof. Floor is formed by the popliteal surface of the femur as well as the capsule of the knee joint. So this is about the boundaries of the popliteal fossa, floor and the roof. Okay, now we will move on to the contents of the popliteal fossa. So stick to the video till the end and make sure to subscribe. Okay, so now moving on to the contents of the popliteal fossa. So what do we have when it comes to the contents of the popliteal fossa? We have the popliteal artery and its branches, popliteal artery and its branches. We also have popliteal vein and its tributaries, popliteal vein and its tributaries. Then we have the popliteal lymph nodes, popliteal lymph nodes, as well as we also have popliteal fat, popliteal pad of fat. Then we also have the tibial nerve and its branches, as well as the common peroneal nerve and its branches. We have the tibial nerve as well as the common peroneal nerve, common peroneal nerve and their branches. So what are the different contents? So what are the different contents of the popliteal fossa we have? We have the popliteal artery and its branches, we have the popliteal vein and its tributaries, we have the popliteal lymph nodes, popliteal pad of fat, we also have the tibial nerve as well as the common peroneal nerve. So actually when it comes to the popliteal fossa, we have the medial bond, superior-medial boundary, superior-lateral boundary, the inferior-medial boundary as well as the inferior-lateral boundary. And when it comes to the contents, we have the popliteal artery and its branches, popliteal vein and its tributaries, we have popliteal pad of fat and some popliteal lymph nodes, as well as we also have the tibial nerve as well as the common peroneal nerve. So this is about the contents of the popliteal fossa. What we have? We have the popliteal artery and its branches, popliteal vein and its tributaries, popliteal lymph nodes, popliteal pad of fat, tibial nerve as well as the common peroneal nerve. So this is about the contents of the popliteal fossa. So yes guys, thank you guys, thank you for watching video till the end. If you like the video, make sure to subscribe and you can also share it to your other friends and people to learn more about the anatomy. Thank you so much.